You suffered from urinary difficulties for a long time, and you were taking a medication before, and you actually saw another urologist before you came in. Is that right?
Correct.
Okay. And what led to your decision to stop taking the medication twice a day and look for a cure?
The ophthalmologist had indicated that there would be potential complications with cataract surgery, and the urinary retention issue got to where it became a real nuisance.
Can you tell us a little bit more about the ophthalmology and what medication were you taking?
I was on tamsulosin or Flomax, and he'd indicated that, I think he had said something about floaters or something, the cataract would kind of break away, which made it more difficult to have a successful surgery.
That is true, and that condition is called intraoperative floppy iris syndrome, and it's a big deal among ophthalmologists. And can you tell us a little bit more about urinary retention? What do you mean by that?
I'd be getting up at a party, I'd be getting up every half hour and having to go urinate. During the night, I'd be up 4 or 5 times. At times, I'd have to really strain to urinate and get a good flow. And it was never emptying my bladder. I mean, it always felt half full or more.
And that was despite taking tamsulosin or Flomax twice a day?
Exactly.
So you were experiencing frequency, urgency, and nocturia, or nighttime urinary frequency?
Right, and initially with the tamsulosin it did help, but then over time it started to decrease its effectiveness.
All right, so how did you end up here at Sunrise Urology?
A referral by my primary, and in the sense that she said, I'd like to have you see a different urologist and see what they have to say.
All right, and you came here and we went through the evaluation for the UroLift system, and actually you had it done a couple of months ago now, right?
6 weeks ago.
Okay, and how are things now?
I couldn't be more happy. It just, urinary retention, I'll sit there all night at a party, not have to urinate. Maybe once, max twice during the night I'll get up. Frequency between urination, often 3-4 hours. So I feel great.
That's awesome. And are you still taking tamsulosin?
No.
That means you can have your eye surgery without worries.
Yes.
Wonderful. Any changes to your sexual function?
No.
After the procedure?
No.
Okay. And how has having the UroLift system changed your quality of life?
I feel normal again. I don't feel like I'm an embarrassment to my wife, let's say, by having to get up and go to the bathroom all the time.
Wonderful. Would you recommend this procedure to those who may need it?
By all means. Like I said, in conversation with Dr. Lin, the first 3 or 4 days after the procedure were pretty rough in terms of bladder spasms, things of this nature, and a little bit of difficulty for pain and urination. But after that, it decreased, and I couldn't be happier.
So 3 to 4 days of short-term, if you want to call this short-term loss, and for a long-term gain. Do you think this is a worthwhile thing to do?
By all means.
Yeah, okay. Wonderful. Thank you so much for letting me interview you.
You're welcome.